Have you ever felt burning, pain, or itching when going to the bathroom, and then noticed blood when you wiped? In that moment, your heart races. You wonder if it's something serious, if you should be worried, or if it's better to just ignore it and move on with your day. But here's something important you need to know: you're not alone. Millions of people live with this discomfort every day, in silence, out of fear, shame, or simply because they don't know what's really going on. That has to change. Today, we're going to talk openly and honestly about hemorrhoids, what they are, why they happen, how to recognize the symptoms, and most importantly, what you can do to treat and prevent them naturally. Because yes, there are solutions. You'll learn how small changes in your diet, your daily habits, and the way you care for your body can significantly reduce symptoms, prevent complications, and help you feel like yourself again. This isn't a minor issue. It affects your quality of life, your sleep, your peace of mind, and even your relationships. That's why, if this topic hits close to home, or you know someone who might be going through it, stay with us until the end. And if you find this kind of content helpful for taking better care of your health, subscribe to the channel and turn on notifications. We talk about the things no one wants to bring up, but that everyone needs to hear. Let's start with the basics. Hemorrhoids, also known as piles, are swollen veins located in the lower part of the rectum or around the anus. Everyone has these veins. It's when they become inflamed or overly dilated that they start causing problems. And depending on the type, the symptoms can vary a lot. There are two main types: internal hemorrhoids, which are inside the rectum and often painless but may bleed or protrude when straining, and external hemorrhoids, which are found around the anus and tend to be the most uncomfortable, causing itching, burning, pain when sitting, or even noticeable lumps. In some cases, external hemorrhoids can swell so much that a blood clot forms, leading to what's called a thrombosed hemorrhoid, an extremely painful condition that needs medical attention. Understanding the difference between the two is key, because the treatment isn't always the same. And while many cases can be managed at home, if ignored, the situation can get worse and affect your life more than you might expect. What are the risk factors? In other words, what increases your chances of developing hemorrhoids? Even though they may seem to appear out of nowhere, hemorrhoids usually develop gradually, as a result of certain habits, physical conditions, or situations that put repeated pressure on the rectal area. The most common culprit is chronic constipation. When someone has difficulty having bowel movements and frequently needs to strain, that pressure builds up over time, weakening the walls of the rectal veins and causing them to swell. It's like a constant push that slowly inflames the area. Another major factor, especially common in today's modern lifestyle, is sitting for long hours. Whether it's at work, in front of a screen, or even on the toilet, prolonged sitting restricts circulation in the pelvic region and increases blood pooling in the anal veins. Excess weight is another key contributor. Abdominal fat puts extra pressure on the pelvis, which can make it harder for blood to flow back through the veins, leading to dilation and swelling. For women, pregnancy is a particularly high-risk time. The growing uterus puts pressure on nearby blood vessels, and hormonal changes can weaken the vein walls. Add in the strain of labor and delivery, and it's easy to see why many women experience hemorrhoids during or after pregnancy. Lifting heavy objects, especially with poor technique or a weak core, can also trigger a sudden increase in pressure in the lower body, which is enough to spark a flare-up. And of course, diet plays a huge role. A low-fiber, low-fluid diet leads to hard, dry stools, which makes bowel movements more difficult and forces your body to push harder. All these factors, poor diet, sedentary habits, physical strain, excess weight, and life stages like pregnancy, have one thing in common: they raise the internal pressure on the veins in your anus and rectum. Over time, that pressure causes inflammation, turning what starts as a minor irritation into a painful and limiting condition. How do you know if you have hemorrhoids? Even though it's a topic many avoid due to embarrassment or discomfort, the truth is, the symptoms are often pretty obvious. The most common, and often the most alarming, symptom is rectal bleeding. This usually happens during or right after a bowel movement and appears as bright red blood on the toilet paper, in the toilet bowl, or even on the surface of the stool. What's tricky is that this bleeding often isn't accompanied by pain, so many people dismiss it, thinking it's not serious. But pain or not, rectal bleeding should never be ignored. It's always a sign that something in that area isn't working properly. Another frequent symptom is itching or burning in the anal region. This discomfort can become persistent and worsen with walking, sitting, or after going to the bathroom. Sometimes it even interferes with daily activities or restful sleep. In the case of external hemorrhoids, many people notice a small lump or hard bump around the anus. When swollen, these can be painful to the touch, make sitting uncomfortable, and create a constant sensation of pressure. Internal hemorrhoids, on the other hand, are often silent, but they can cause a feeling of incomplete evacuation, heaviness in the rectal area, or even protrude during bowel movements, a condition known as prolapsed hemorrhoids. Sometimes they retract on their own. Other times, the person has to gently push them back in. This can be incredibly distressing, especially if you're unsure of what's happening. There are also lesser-known but equally important symptoms. Some people experience anal discharge, which creates a constant feeling of moisture that can irritate the skin and increase the urge to scratch. That friction only makes things worse, leading to more swelling or even small skin tears. What matters most is not to normalize these symptoms. Burning, bleeding, lumps, or constant discomfort are not a normal part of life. And here's an important disclaimer. While this video gives you valuable insights into what might be happening with your body, no YouTube video replaces a proper medical evaluation. Rectal bleeding, for example, can also be linked to other conditions like anal fissures, polyps, infections, or in more serious cases, colorectal cancer. So if you're experiencing frequent bleeding, intense pain, persistent lumps, or any symptom that doesn't go away over time, it's best to seek medical attention. Getting an early diagnosis can be the difference between a simple solution and a serious complication. Listening to your body isn't overreacting. It's self-care. Have you ever experienced any of these symptoms and thought it wasn't a big deal? Tell me about it in the comments. Sharing your story might help someone else going through the same thing. Simple daily habits that help prevent hemorrhoids. Now that you understand what hemorrhoids are, why they occur, and how to recognize them, let's talk about the most important part, prevention. Avoiding them, or keeping them from coming back if you've had them before, is absolutely possible, and it starts with the small daily habits you repeat almost without thinking. One of the cornerstones is your diet. Eating enough fiber is key to keeping your digestion running smoothly and preventing constipation, which, as we've seen, is one of the leading causes of hemorrhoids. Fiber acts like a sponge in your intestines. It absorbs water, adds bulk to your stool, softens it, and helps it pass without strain. The best sources are fresh, natural foods, fruits with skin like apples or pears, raw vegetables like carrots and spinach, whole grains like oats and brown rice, legumes like lentils, chickpeas, and beans, and seeds like chia and ground flaxseed. But eating fiber alone isn't enough. You have to drink water. Without proper hydration, fiber can harden and actually make constipation worse. Ideally, you should drink 6 to 8 glasses of water a day, or more if you live in a hot climate, exercise regularly, or consume lots of insoluble fiber. Another essential habit is to avoid straining during bowel movements. Going to the bathroom shouldn't feel like a battle. Holding it in for too long, pushing too hard, or spending more than 5 minutes on the toilet weakens the veins in the rectal area and increases inflammation. Try to establish a regular routine, preferably after a meal, so your body gets used to going naturally. Many people also find it helpful to use a small stool to elevate their feet while sitting. This position straightens the rectal canal, relaxes pelvic muscles, and makes the process easier and less stressful on your body. Movement is also key. Sitting for long periods, at a desk, on the couch, or behind the wheel, causes blood to pool in the lower body, including the rectal veins. This constant pressure increases the risk of inflammation. That's why it's important to get up at least once an hour, take a short walk, or do some light stretches. A daily movement routine, even if it's low intensity, helps boost circulation, strengthens your core, and keeps your digestive system active. A 30-minute walk, gentle yoga, swimming, or mindful stretching can make a huge difference in your digestive and circulatory health. And don't forget hygiene. After a bowel movement, many people use rough, perfumed, or alcohol-based toilet paper without realizing it can worsen irritation. The best option is to use warm water to rinse the area, or fragrance-free, chemical-free wet wipes. Pat dry with a soft towel. Don't rub. Keeping the area clean and dry helps prevent itching, irritation, and moisture-related infections. But be careful not to overdo it. Excessive cleaning can damage the skin's natural barrier. As you can see, preventing hemorrhoids doesn't require expensive treatments or drastic changes. It's about simple, daily choices. What you eat, how you hydrate, your bathroom habits, how much you move, and how you care for your body. These small adjustments, done consistently, can spare you years of discomfort, pain, and, often, avoidable medical procedures. Have you already started practicing some of these habits? Or is there something you still find challenging to change? Share your experience in the comments. Your story might be exactly what someone else needs to hear today. Anti-inflammatory nutrition, the key to reducing pain and preventing hemorrhoids from coming back. When we talk about hemorrhoids, many people assume the issue only shows up in the bathroom. But the truth is, it often begins much earlier, in the kitchen. The way you eat has a direct impact on your digestion, your vein health, and the level of inflammation in your body. And this is where anti-inflammatory nutrition becomes essential. It's not a passing trend or a restrictive fad. It's a natural science-backed approach designed to calm down the silent inflammation that damages tissues, weakens blood vessels, and triggers discomfort. By lowering inflammation, you can not only relieve hemorrhoid symptoms, but also improve circulation in the rectal area and strengthen vein walls, helping prevent future flare-ups. The first step is increasing fiber, but not just any kind. You need a variety of natural sources. Soluble fiber, found in oats, chia seeds, and ground flaxseed, forms a gel-like texture in the gut that softens stools and makes them easier to pass. Insoluble fiber, present in leafy greens, fruit skins like apple and pear, and whole grains like brown rice and barley, stimulates bowel movement and helps keep things regular. This combination not only reduces constipation, but also limits the strain during bowel movements, directly protecting the veins in your rectum. Aim for 25 to 30 grams of fiber per day, but increase it gradually to avoid gas or bloating. Step 2 is to bring in naturally anti-inflammatory foods. Omega-3s, polyphenol, flavonoids, and antioxidants are your allies here. Salmon, sardines, tuna, walnuts, and flax seeds are rich in omega-3s, which protect your vascular system. Berries like blueberries, strawberries, and blackberries are loaded with anthocyanins that reduce inflammation and improve vein elasticity. Bright-colored vegetables like broccoli, beets, and carrots provide antioxidants that repair tissue, improve blood flow, and support your immune system. Turmeric and ginger act like natural anti-inflammatory medicine, but without the side effects. You can add them to soups, smoothies, teas, or salad dressings. Flavonoid-rich foods are also key. They help strengthen blood vessel walls and include red onions, citrus fruits, garlic, green tea, pure cacao, and tomatoes. These foods support circulation and reduce the likelihood of future hemorrhoids by making your capillaries more resilient. Now, just as important as what you add is what you remove. For an anti-inflammatory diet to work, you need to reduce or eliminate foods that trigger inflammation, especially in the gut. That includes refined sugars, white flour, processed foods, cured meats, fried snacks, excess salt, sugary drinks, and alcohol. These not only irritate your digestive tract and worsen constipation, but also slow down your body's ability to heal. Too much coffee can also be an issue, especially if you're not well hydrated. It can dehydrate you, overstimulate your gut, and irritate the anal lining in sensitive individuals. Lastly, Don't forget the power of fermented and prebiotic foods. Kefir, plain yogurt, sauerkraut, miso, kimchi, and even cooked green bananas help rebuild a healthy gut microbiome. When your gut bacteria are balanced, digestion improves, inflammation drops, and bowel movements become easier and more regular, all of which reduce the pressure that leads to hemorrhoid pain. Over time, this means fewer flare-ups and a much higher quality of life. Have you tried anti-inflammatory eating before? Is there a particular food that really helped you? Share your experience in the comments below. It might help someone else who's going through the same thing. Home remedies that actually work to relieve hemorrhoid discomfort. If you're already dealing with itching, pain, or swelling, here's some good news. There are home remedies that can help relieve the symptoms without needing immediate medications or invasive treatments. These natural methods are especially effective in the early stages, when used consistently and combined with healthy habits. One of the most recommended by health professionals is the sitz bath with warm water. This involves soaking the anal area in clean, lukewarm water, not hot, not cold, for 15 to 20 minutes, 2 or 3 times a day. This simple habit relaxes the sphincter muscles, reduces inflammation, and soothes burning or itching sensations. It's particularly helpful after a bowel movement or before bedtime. In cases of more intense inflammation, you can also use ice or cold compresses wrapped in a soft cloth, applied to the area for 10 to 15 minutes. This helps reduce pain, swelling, and redness. Just be sure not to apply ice directly to the skin, as that could cause a cold burn. Another trusted natural ally is aloe vera gel. Thanks to its soothing, healing, and anti-inflammatory properties, you can apply it gently several times a day to calm irritation and support skin recovery. Ideally, use pure gel straight from the plant, but if using a store-bought version, make sure it's free of fragrances, dyes, and preservatives. Witch hazel is another standout remedy. This plant has astringent properties that help ease itching, reduce swelling, and minimize light bleeding. You can apply it with a cotton pad, but avoid it if you have open wounds or visible fissures. For external hemorrhoids, some people find relief using natural plant-based oils like coconut oil or calendula oil. These oils have antimicrobial and anti-inflammatory effects, help keep the area moisturized, reduce friction, and support tissue regeneration. Some also prepare sitz baths using medicinal herbs like chamomile or rosemary. These have calming, antiseptic, and relaxing effects on the skin and muscles. It's important to remember that while all these remedies can help ease symptoms, they don't replace medical evaluation. If the pain is intense, the bleeding doesn't stop, or your condition doesn't improve within a few days, you should definitely consult a doctor. A timely diagnosis can prevent complications and lead to more effective treatment. These home remedies are not magical cures, but they are part of a holistic approach that honors the body's healing rhythm and supports natural recovery. When combined with a high-fiber diet, proper hydration, and good hygiene habits, they can make the difference between ongoing discomfort and the lasting relief you've been looking for. Have you tried any of these natural remedies? Which one worked best for you? Share your experience in the comments. It might help someone else going through the same thing. What to do when home remedies aren't enough? While many cases of hemorrhoids can improve with home care and lifestyle changes, there are times when that just isn't enough. If the pain becomes intense, the bleeding lasts for several days, the hemorrhoids prolapse frequently, or the discomfort starts interfering with your daily life, it's time to consider other options under medical supervision. The first step in these situations is usually the use of topical treatments. There are creams, ointments, and suppositories that contain anti-inflammatory agents, local anesthetics, or corticosteroids. Their main goal is to reduce swelling, relieve burning sensations, and control itching. Some of these products are available over the counter, but it's always best to consult a healthcare provider to find out which treatment is right for your specific condition. If symptoms don't improve with topical treatment, your doctor may recommend outpatient procedures that are done right in the clinic and don't require hospitalization. One of the most common is rubber band ligation, where a small band is placed around the base of the hemorrhoid to cut off its blood supply. In a few days, the hemorrhoid dries up and falls off on its own. Another frequently used technique is sclerotherapy, where a special solution is injected into the hemorrhoid to shrink it. Infrared or laser coagulation is also an option. This method uses heat to close off the affected veins and relieve the symptoms. These procedures are often very effective, especially for moderate cases. But if the hemorrhoids are large, extremely painful, or haven't responded to any previous treatment, surgery might be necessary. The most well-known surgery is hemorrhoidectomy, which involves the complete removal of the hemorrhoids. It's a permanent solution, but is typically reserved for the most severe cases. A less invasive option is stapled hemorrhoidopexy, where prolapsed hemorrhoids are repositioned inside the rectum, and their blood flow is interrupted to reduce inflammation. It's important to understand that treatment choices are never one size fits all. They depend on the severity of the condition, the patient's medical history, and a full medical evaluation. No one should normalize chronic pain or settle for ongoing discomfort that affects both physical and emotional well-being. If home remedies haven't worked for you, seeking medical help isn't a sign of failure. It's a brave and responsible decision. What may seem like a minor issue can become a serious complication if ignored for too long. And above all, never self-medicate or make decisions based solely on what you read or watch online. This video is meant to inform and guide you, but the proper diagnosis and treatment can only come from a qualified medical professional. And if you're looking for a natural and proven way to reduce inflammation, improve digestion, and support your body from within, especially if you've been struggling with hemorrhoids, we've created a step-by-step solution just for you. Check out our ebook, Keto Made Easy, a 28-day plan for beginners. It's not just about weight loss, it's a complete anti-inflammatory nutrition guide designed to improve gut health, ease bowel movements, and reduce the pressure that leads to hemorrhoids. With simple recipes, daily plans, and expert advice, this guide helps you regain control of your health, one meal at a time. You can get your copy through the link in the description below. If this video helped you understand more about your symptoms and gave you tools to take action, hit the like button, subscribe to the Wellness Insight, and share this video with someone who might need it. Have you ever tried adjusting your diet to relieve hemorrhoid symptoms? Let us know in the comments. Your experience might be exactly what someone else needs to hear. And stay tuned for our next video, packed with more science-based tips to help you feel better naturally.